Welcome to The Explainer. Today, we're digging into something almost everyone has experienced, but that can still cause a lot of anxiety: swollen lymph nodes. We're going to break down exactly what your body is trying to tell you when you find one of those unexpected lumps.
All right, so here's our game plan. We're going to walk through this just like a doctor would. We'll start with that initial signal, look at all the possible causes, follow the step-by-step diagnostic path, see how the lab decodes the tissue, and wrap up with the key things you really need to know.
Okay, let's start at square one. What exactly is this signal your body is sending when a lymph node decides to swell up? What does it all mean?
I mean, who hasn't, right? You're showering or just scratching your neck, and bam, there it is. A little lump that definitely wasn't there yesterday. And your mind can immediately jump to the worst-case scenario. But let's unpack what's really going on.
So, there's a medical term for this: lymphadenopathy. But here's the most important thing to get right away. It's not a disease. Not at all. Think of it more like a blinking light on your car's dashboard. It's just a sign, a heads up from your body that it's busy working on something. Exactly. This is the perfect way to picture it. Your lymph nodes are basically the little command centers, or fire stations, of your immune system. And when any kind of alarm goes off, they kick into high gear, swell up with immune cells, and get to work. All right, so the alarm is ringing. The next big question is, what's pulling the trigger? And the truth is, the list of potential causes is huge, ranging from something as simple as a cold to some really rare diseases. To sort through all the possibilities, doctors often use a clever little tool called the MIAMI mnemonic. And what this shows you right off the bat is that malignancy, the M, is just one of 5 categories. The cause could just as easily be an infection, an autoimmune issue, or even something caused by a medication you're taking.
The real detective work starts with the physical exam. How the node actually feels gives the first big clues. If it's kind of tender, soft, and you can move it around, that often points to something benign, like your body fighting off an infection. But if it's painless, hard as a rock, and feels stuck in one place, well, that's when the level of concern goes up.
And get this, where the node is located is like a big pin on a map. A swollen node in the neck? Probably just a sore throat or a dental issue. But check out the supraclavicular node, the one right above your collarbone. That one is a big deal. It's considered a major red flag because it can be the first sign of a problem deeper down in the chest or abdomen.
Now, sometimes the cause is what we call iatrogenic, meaning it's triggered by a medical treatment. A wild example is something called DRESS syndrome. And as this quote explains, it's super tricky because you might start a new drug, feel fine for weeks, and then your lymph nodes swell up. That's because the drug can wake up a dormant virus in your body, and it can look a lot like lymphoma at first.
And then you get into the really rare stuff, like Rosai-Dorfman disease. It sounds scary, right? It can cause huge, swollen lymph nodes. But here's the twist. It's a completely benign disorder. This is the perfect example of why you can't jump to conclusions, and why getting that final tissue diagnosis is so absolutely critical.
So, with this whole spectrum of possibilities, how in the world do doctors figure it out? Well, they don't just guess. They follow a very clear step-by-step diagnostic pathway. The journey is almost always the same. It starts with you, your story, your symptoms, where you've traveled. That's step 1. Then, if needed, comes step 2, advanced imaging, to get a peek under the skin. And if there's still a question mark, you move to step 3, the biopsy, where we get the definitive answer from the node itself. Imaging is really cool because it lets doctors investigate without having to cut. And ultrasound gives a basic look at the node's size and shape. A CT scan can spot worrisome features, like if the center of the node looks like it's decaying. Then there's the PET scan, which shows hot spots of activity. But, and this is a big but, a hot spot doesn't automatically mean cancer. A really bad infection or inflammation can light up like a Christmas tree, too. In fact, the technology is getting crazy good. A big analysis of a special technique called contrast-enhanced ultrasound found that it has a 94% accuracy rate for telling benign and malignant nodes apart. I mean, that is incredibly powerful for a non-invasive test. So, if a biopsy is the next step, how you get that tissue sample matters a lot. A fine needle aspiration just sucks up some loose cells, which is often not enough information. It's like trying to solve a puzzle with only a few random pieces.
That's why an excisional biopsy, where they remove the whole node, is the gold standard. It gives the pathologist the entire puzzle to work with.
All right, that tissue sample is off to the lab. This is where the mystery gets solved. A pathologist is about to look under a microscope and decode the story that's written in the very cells of that lymph node.
A biopsy is what takes us from "I think" to "I know." It's not about educated guesses anymore. The pathologist can actually see the unique cellular signature of whatever is going on, whether it's a specific infection, an autoimmune disease, or a malignancy. It's the final word.
And this is where it gets fascinating. Under the microscope, every condition leaves behind a different fingerprint. For instance, tuberculosis leaves behind clumps of cells that have a caseating or cheesy-looking center. Sarcoidosis also has clumps, but with no decay. And remember Rosai-Dorfman disease? It has this totally unique and bizarre feature where pathologists literally find one cell living inside another one. It's like high-stakes cellular detective work.
And what about those nodes that are really deep in your chest and hard to get to? Well, we have amazing technology for that too. A procedure called EBUS-TBNA lets doctors go in through the airways with a tiny scope to get a sample. It has an incredible 92% diagnostic success rate and often means patients can avoid a much bigger, more invasive surgery.
Wow, okay. We have gone from a simple lump to the world of high-tech pathology. So after all of that, what are the most important things for you to walk away with?
If you remember anything, remember this. You are a crucial partner in this process. Time is a factor. If a node sticks around for more than a few weeks, get it checked. Location is a clue, especially that spot above the collarbone. And most importantly, your story, your symptoms, your travels is one of the most powerful tools your doctor has to solve the puzzle.
In the end, a swollen lymph node is just your body sending you a signal. It's a call to attention, and hopefully, this explainer has helped you see that there is a logical, systematic journey to finding the answer, a journey that should empower you with knowledge, not fill you with fear. Thanks for joining us.